Thank you so much for joining me today. My name is Jill Cotchen. I'm a solutions executive over our clinical and operational division within Vizient Inc., GPO nationally across the country. I'm going to talk with you today about the importance of looking at all data elements across the patient encounter, not specifically supply chain information, pharmaceuticals, or even outcomes-driven information. The importance of evaluating all of it together is that we need the stakeholders from which each department to come together and make decisions, clinically driven decisions, some based off evidence and encounter information, others just based off their experience. We need all groups to have a conversation at the table. And what we have found through years and years of work and in building some of our technology tools is that it's important to get every person's influence, I would say, and more importantly, their feedback, because each person looks at different elements. Specifically, if you're talking with a finance leader, they may be more driven based off the margins and the information about, whether or not this is a profitable service line for us. Are we looking at the right aspects when we're trying to grow profitable volumes? If you're talking with a clinician, well, they're focused on their outcomes, specifically their readmission rates, their complication rates. But if you're looking at, your performance improvement overall, like a quality leader, a medical officer would be, they're looking at patient care, they're looking at returns to the OR, but a supply chain leader may be more focused around the cost to actually procure the device itself. They may be also looking to understand if they're actually getting the clinical outcomes that physicians promise them are associated with some of these devices. So it's bringing all those data elements together into one platform to be able to assess from admit to discharge, how well are we treating the patient? Are we really getting the value of the care that we're providing and our financial and clinical goals? Overall, when we look at this at Vizient and with our members that we work with, what we start to understand is that as we're working with them each individually, it's important that we understand what are the questions that they're trying to answer. A CNO being more driven around the actual floor and the experience for the patient. A chief medical officer, as I mentioned, may be looking at some of the outcomes-related data. But what are those elements that cross over? So specifically, if we bring in this new device, what are the outcomes, the length of stay associated with that new device? If it should be promising me 1 to 2 days shorter length of stay, if a patient should be getting up and walking quicker because we gave them this drug, for instance, from a pharmaceutical perspective early on in their care, is that actually happening? Are we changing our protocols for how we treat these patients because we are giving them new products or treating them with new drugs that should be helping them to improve their quality after post-surgery and getting them into the hospital, out of the hospital quicker as we had promised them? And so when we're speaking with executives across the organization and they're looking at different data sets and data elements and working with different providers in the marketplace to bring in new technology that'll give them insight into these areas, what we have found is that breaking it down by each department and what the most important aspects of their work is, that's where we find that we're really starting to see the value-based outcomes that we're looking for. So for instance, in transparency, everybody in that marketplace is looking at transparency. Some departments have limitations in what they're looking at. For instance, supply chain leaders are limited, by antitrust laws and things like that to be able to see pricing transparency when it comes to different institutions. But if you're looking at, medical-driven outcomes, you want to know who are the leaders in care. You want to be able to model after them and you want to be able to pinpoint them. Specifically, are these organizations like me? Do they treat the same types of patients? Do they have a lot of trauma coming through their organization? Do they treat smaller markets? Those are all very important. So it's about being able to provide the different data elements to each of these different stakeholders to the best that we can. Another great example is just benchmarking holistically. We want to benchmark at different levels, at the service line level, at a physician level, even at a product level. How can we gain more transparency into some of those benchmarks? For instance, can we give better data elements to our supply chain leaders? Not just telling them, specifically that this might be a, tibial insert, but is it a cross-link polytibial insert? And where should your pricing be and your utilization be for these specific supplies? In terms of looking at, overall just, an integrated platform and information coming into one area, that's something else that we want to help our organizations assess. So being able to pull different data elements from finance and with quality information. So as we're thinking about, that readmission to the organization, How much did it actually cost us at the end of the day? How much are these repeatedly costing our organization, specifically for a certain type of procedure that we're performing? If we're introducing new data, new products every day, we hope that we are actually limiting ourselves in these areas. And these new products, even though it'll be an additional cost to the hospital, it'll, in the long run, save us in some of these other data elements and metrics that we're evaluating. So when we evaluate all these different areas, we're helping organizations to not have just one lens, but we want them to evaluate the entire patient encounter. So from admit to discharge, we want to treat them holistically together. We don't want to treat them in data silos. Finance, for example, might not be that large of a part of the picture in the beginning. They certainly are looking at it on the back end. And so if we can get all of our data elements together to assess true cost per care for our patients, that'll only help all the different stakeholders at the end of the day. Overall, the direction that healthcare is heading in is, clinical outcomes, quality outcomes. Overall, are we getting the best value for the care that we're providing? So by able to provide these different data elements and transparency across their service lines and how they're treating their patients will only help us to grow stronger together and better holistically, not just by an organization, but overall in how all hospitals are treating their patients. So thank you. I hope this has been informational to help you understand exactly what data elements you may want to start looking at with your different providers, as well as your different stakeholders across your organization. Each of these are not unique to any one hospital, but can be used by any organization. Thank you for your time, and I hope this was beneficial.